Emily Senseman, and I am here at the 501st MI Behavioral Health Fair. It's part of a bigger week-long PMCS Behavioral Health Week, a really novel idea that the 501st MI Brigade is offering to all the soldiers here. And you can see lots of resources that they're sharing with the soldiers that have been around, but maybe a lot of these soldiers didn't know much about.
The theme of this week is reach out to help and reach out for help. So we wanted to make sure that our formation understands that if they're having troubles, mental health-wise, behavioral health-wise, that they can reach out for help.
So this is a greater initiative. We have a people-first strategy that we're trying to take care of and get after the three corrosives in the Army: EO issues, SHARP issues, and behavioral health issues.
What are you telling soldiers here today? What is the message you want them to hear?
That the chaplain in the UMT has a lot of resources for them if they're looking for religious support or personal support. We have counseling for our soldiers, and chaplains and religious affairs specialists and NCOs have absolute confidentiality.
People around the world does it every day. You know, they drink, they vape, but in the military it's a little bit trickier. Opening and closing your eyes, you can definitely lose your career. So we have information to give them, some tools to give them to basically help them, stay safe.
The specific program for civilians is the Employee Assistance Program. We do solution-oriented, job-focused, or if anyone's having performance issues on the job or having just life issues in general, it's essentially a support service available to all DoD civilians.
The Army Wellness Center is very important because mentally, if we have a healthy body, it's going to impact our mental health as well. We provide metabolic testing, we provide body composition, stress management, fitness tests, and health coaching. Health coaching can be tailored to the individual of what they want to learn more about.
Well, today I hope that we at the SHARP table impart enough information to make everyone more confident in the program, so someone can come talk to us, and anything that they say to us as it pertains to a sexual assault is covered by Military Rules of Evidence 514, which is the victim advocate confidentiality clause.
So we have a new building opening up very soon. We're looking at probably March time frame. This is a resource center for all the soldiers to come here for a one-stop shop. And one of the things that we have in here is a meditation room where it's going to have a place where people can actually cool down. We have a stairwell that's going to be built in. It kind of sections off to not show where these soldiers are going, so they have that privacy.
There's been this pervasive air of uncertainty, and we know that we've all been impacted by COVID-19. What I do is listen very intently to what soldiers have to say, soldiers and family members, and then together we come up with a strategy to help solve and resolve their difficulties.
We had the Commanders Conference, was like the first event that started off the PMCS of the week. Well, commanders have certain responsibilities through the course of behavioral health care. Taking care of our soldiers, right? The commander's responsible for everything the unit does or fails to do. The thing I appreciated the most about the Commanders Conference was having the actual behavioral health care specialists who treat individuals on a regular basis.
There's so many great ideas that came out of this week that we're going to be able to replicate across the entire formation. It's just easy wins to take care of the team. We're also doing PT as leaders with the squads so that we can talk to the young soldiers face to face and understand the dynamic problems that they're facing throughout their formations. 6, 7, 8, 9.
I've been here since June 2019. I didn't know about none of these buildings that we went over there. I learned a lot of new stuff here. Just knowing that there's people out there that's willing to help us and we have the help, it's good to know that you're able to lean on somebody.
I thought it was going to be like a big waste of time, but I was wrong. I didn't know that there were so many resources available to us.
We all hurt, and it's just a natural part of being human, but it's not okay to hurt alone, because there's friends and there's teammates and your superiors, chain of command, and resources here that can help you through the tough times that you might be going through.
So if you weren't able to make it today, or maybe you're a family member that wasn't able to attend, there's more information about all the resources discussed here on this Facebook page. I'm Emily Senseman, reporting for the 501st.